So we're going to look at some common prenatal traumas. So what's actually happening in there? We can't see what's happening in there, except with ultrasound, perhaps. But we don't see, says true, it's difficult to see emotions with ultrasound. And I realize I don't want to say we can't see them because actually on ultrasound, you can see a baby contracting. You can see them pulling away, for example, from an amniocentesis needle. You can see them responding to their environment. Okay. But that is often interpreted as reflex. But what we know from people who are able to come into a place of talking about or in some way depicting their early experiences, they actually were having an internal experience, not just a reflex. So probably the most challenging thing that can be happening in there is to be unwanted or rejected, because little ones in the womb are completely dependent on their mother for survival. And if their mother doesn't want them or is ambivalent about having them, that's absolutely terrifying for the little one, intelligently so. They need to be received. They need to be welcomed. So I'm taking a breath around that. Okay. We'll look at that a bit more in a moment. Another very common trauma is to lose a twin in the womb. Over half of conceptions, human conceptions, are multiple, but fewer than half of human births are multiple, which suggests that many of us have lost a twin. And it's probably the most common theme that I've encountered in all my years of working with pre and perinatal psychology and therapy. It comes up in every single class. Usually several people um, identify with having lost a twin at some point. And often that happens very early. So the surviving twin may be the only person who was aware of having a twin. It doesn't show up on ultrasound until later. So that loss is never acknowledged out loud. It's never reflected. And I think I mentioned last time I've recently had a book published called The Prenatal Shadow, because it seems to me that our prenatal and birth experience is almost by definition unconscious shadow material because it isn't acknowledged and reflected and brought into consciousness and words. And so when we've had an intense loss like that, often babies in the womb or after birth too are actually closer to their twin than they are to their mother. So when they've lost that person, it's a huge loss. And if it's never acknowledged, they often go through life having this unexplained grief, maybe depression. Maybe they're always looking for their twin. I know that I've had that experience, which a lot of my clients have had also, where I would meet somebody, potential relationship. I go, oh, that's him. My twin was a boy. Um, I go, that's him. It's like I wasn't thinking that's my twin because I wasn't conscious of having lost a twin at that point. But the soulmate I've been seeking, that's him. Until I get to know him and go, ooh, that's not him. Don't know if anybody here has that experience. Um, so doing pre and perinatal therapy, I realized, oh, I've been looking for my twin. And eventually I got through that so I could actually have a good relationship with someone who may have actually been my soulmate, but I wasn't twinning with him. So important to acknowledge that that's something that happens a lot. And it's not always true that nobody knows about the lost twin. There's something called the vanishing twin syndrome, where twins are seen on um, the ultrasound, and then the next time there's only one. And seems the twin has died and it's been reabsorbed either into the mother or the surviving twin. So, yeah, twin loss is a big thing. And so I was saying, when there's a vanishing twin syndrome, there's an awareness that a twin has been lost, but there's usually no awareness that the surviving twin would be affected by that, would have had an experience because, babies in the womb aren't conscious. They're not believed to be having experiences. So I'm on a mission to change that because clearly we have experiences and they affect us. Another major issue in the womb that's also quite common is what we call the haunted womb syndrome. And that refers to when there's been a previous occupant in the womb. So if there's been a miscarriage or abortion or stillbirth, or maybe a twin was lost earlier, although usually haunted womb refers to when the mother or the parents have unresolved feelings around the loss. And so William Emerson would say that the prenate marinates in the unconscious of the parents. So that baby is marinating in a womb that's full of probably terror from the baby that died, probably grief and loss from the mother, maybe anger from somebody. And we talked a bit last time about how babies don't differentiate. Okay, they experience things directly, somatically. So if they're marinating in grief, they just experience that directly as if it's their own. And they become that, they identify with that. So really helpful to be looking at prenatal history. Were there any losses before you came along? And that can help the person to understand, to put their feelings in some context and not have to hold on to them so much. Another important one we call umbilical affect, and there's also umbilical toxicity. Affect, you probably know, is a psychological term for emotion. And umbilical affect is a term that I learned from William Emerson, who learned it from Frank Lake. Um, and it was actually Francis Mott who came up with the term. He was a pioneer in the field a long time ago. And it refers to how the baby in the womb is receiving the affect, the emotional experience of the mother. So there are many traditions where it's really emphasized that the mother needs to not be exposed to any negative experiences, right? That's very wise. Hard to do that in our modern world. But if the mother is having strong emotions or having a lot of stress or extreme stress, that affect comes into her little one.